Hello dear students, welcome back to the channel. In today's video, we are going to discuss an important topic, the physiology of lactation. By the end of this session, you will clearly understand how breast milk is produced and released, and the role of hormones in this wonderful, natural process. Lactation is the natural process by which a mother's mammary glands produce and secrete breast milk, usually beginning after childbirth. This process is essential for providing newborns and infants with complete and balanced nutrition, including proteins, fats, vitamins, and antibodies that support growth, development, and immunity. Lactation is carefully regulated by hormones, primarily prolactin, which stimulates milk production, and oxytocin, which triggers the release of milk when the baby suckles. Beyond nutrition, breastfeeding also promotes a strong emotional bond between mother and child and adapts to the baby's needs, making it a remarkable and vital physiological process. Now we're going to talk about the physiology of lactation, starting with mammogenesis, which is the process of breast preparation for breastfeeding. During pregnancy, the breasts grow and develop to get ready for milk production. The tiny ducts that carry milk grow and branch out under the influence of estrogen, while progesterone helps form the alveoli, the small sacs where milk is made. Other hormones, like prolactin, placental lactogen, cortisol, and insulin, also play important roles in preparing the breasts for lactation. You can think of it like a factory getting ready. Estrogen builds the milk pipes, progesterone builds the milk rooms, and prolactin makes sure everything is ready to start producing milk after birth. Now let's talk about lactogenesis, which is just a fancy word for how milk is made and released in the breasts. The first stage, Lactogenesis 1, happens during pregnancy, even before the baby is born. The breasts start preparing for milk production, and small amounts of colostrum, that thick, yellow, nutrient-packed first milk, are formed. This is all thanks to the hormone prolactin. Then comes Lactogenesis 2, which happens about 2 to 4 days after birth. Once the levels of estrogen and progesterone drop, prolactin kicks in fully, and this is when the milk really comes in. Mothers usually notice their breasts feel fuller and heavier during this stage. Finally, Lactogenesis 3 is all about keeping milk production going. This depends on the baby feeding regularly. The more the baby suckles and milk is removed, the more milk the body makes. It's a natural supply and demand system, which makes sure the baby always gets enough. Next, let's look at Galactokinesis, which simply means the ejection or release of milk from the breast. This process is mainly controlled by something called the oxytocin reflex, also known as the letdown reflex. Here's how it works. When the baby suckles at the nipple, nerve signals travel to the mother's brain. This stimulates the posterior pituitary gland to release a hormone called oxytocin. Oxytocin then makes the tiny muscle-like cells around the milk-producing alveoli, called myoepithelial cells, contract. Because of this contraction, milk is squeezed out from the alveoli into the ducts and finally released for the baby to drink. So, in simple words, baby suckling leads to oxytocin release, which causes the milk to flow. That's why this is called the letdown reflex. End of. The image shows how the letdown reflex works during breastfeeding. When the baby sucks at the nipple, nerve signals travel to the brain, triggering the release of the hormone oxytocin. Oxytocin causes the small muscles around the alveoli, milk-producing sacs, to contract, pushing milk through the milk ducts toward the nipple. This allows the baby to feed easily. The diagram may also show that this reflex can be triggered by hearing, seeing, or thinking about the baby, not just by sucking. Finally, let's talk about Galactopoiesis, which is the process of maintaining milk production over time. Milk production doesn't just stop after it starts, it needs to be continued. This happens through regular suckling by the baby and the emptying of the breasts. Every time the baby feeds, nerve signals trigger the release of prolactin, the hormone responsible for making milk. So prolactin released during feeding keeps the milk supply going. In simple terms, the more the baby feeds, the more milk is produced, thanks to this natural supply and demand system. Regular breastfeeding ensures the baby always has enough milk, and the mother's breasts continue producing it efficiently. Now we will see about lactation management. Lactation management is all about helping mothers breastfeed successfully and keeping both the mother and baby healthy. It includes showing the mother the right position and latch, encouraging frequent feeding to make enough milk, and helping with common problems like sore nipples or engorged breasts. It also involves supporting the mother with good nutrition, rest, and emotional care, because a healthy, relaxed mother can feed her baby better. The goal is to make breastfeeding comfortable, effective, and safe for both mother and baby. The most important component of lactation management is initiation of breastfeeding. Breastfeeding should be started within the first hour after birth. It's important to encourage rooming in, where the baby stays close to the mother, and demand feeding, meaning the baby is fed whenever they show signs of hunger. The next important is positioning and latching. Proper positioning helps the baby feed comfortably and prevents nipple pain. The baby's head and body should be in a straight line, facing the breast. The mouth should be wide open, with the chin touching the breast and most of the areola inside the baby's mouth, not just the nipple. This ensures effective sucking and milk transfer. Now let's talk about how often and how long to breastfeed. Babies should be fed on demand, usually 8 to 12 times a day, whenever they show signs of hunger. It's also important to offer both breasts alternately so that the baby gets enough milk and both breasts are stimulated to produce milk. Next is mother's care, which is just as important for successful breastfeeding. Mothers should eat a balanced diet, stay hydrated, and get enough rest. Proper nipple care is essential too. Keep them clean and dry, and avoid using harsh soaps that can irritate the skin. Wearing a supportive bra can also make breastfeeding more comfortable. Taking care of the mother helps ensure she can feed her baby effectively and stay healthy. Next, let's talk about some common breastfeeding issues and how to manage them. First is breast engorgement, which happens when the breasts become overly full and uncomfortable. This can be relieved by frequent feeding, applying a warm compress before feeding to help the milk flow, and a cold compress after feeding to reduce swelling. Another common issue is sore nipples, often caused by incorrect latch. Ensuring a proper latch is the first step to prevent pain. You can also apply expressed breast milk or lanolin to soothe the nipples. Sometimes mothers worry about having less milk. In most cases, it's normal, and reassurance helps. Encouraging frequent suckling, maintaining a healthy diet, and staying hydrated usually improve milk supply. With the right care and support, most breastfeeding problems can be managed effectively. That brings us to the end of today's session on physiology of lactation. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, share, and subscribe for more nursing and health-related content. See you in the next video.